Hello and welcome to this presentation on the disease tuberculosis. My name is Goldstein and this is for Professor Austin's Biology 160 class. The purpose of this presentation is to describe tuberculosis and its characteristics in order to foster public awareness and to help prevent the spread of tuberculosis. First, a little background. Tuberculosis is a bacterial infection that is potentially fatal. Based on skeletal remains and written descriptions, it has affected humans for thousands of years. The cause of the disease was first discovered by Dr. Robert Koch in 1882 as the microorganism Mycobacterium tuberculosis. Once infected with this mycobacterium, it grows in a person's lungs and then may spread to other organs as well. In that case, it would be called extrapulmonary tuberculosis. It spreads from host to host via respiratory pathways, such as when people cough or sneeze. Here we see a picture of a hospital ward of tuberculosis patients in Ohio taken in the early 20th century. They're all grouped together because they already have tuberculosis. Apparently, they were in this room for sunlight and fresh air ventilation, which were thought to be curative at the time. There's a significant rate of tuberculosis death, with an estimated 1.3 million deaths in the year 2020, plus an additional 200,000 deaths in people with HIV. In fact, it is estimated that a quarter of the global population is infected with tuberculosis, but about 90% of these cases will remain latent throughout the life of the host. So what causes tuberculosis? Mycobacterium tuberculosis is a rod-shaped bacterium, or bacillus, and is the cause of the disease. It spreads between hosts in the air, as we mentioned before, by coughing and sneezing, etc. And if the immune system fails to eliminate the bacteria initially through phagocytosis, the bacteria will reproduce quite rapidly, and then symptoms may appear within weeks, or they may delay for any amount of time, even many years, which is called the latency period. The symptoms that will appear when tuberculosis is active are quite varied. If the disease is left untreated, it can very well be fatal. There are two major categories of tuberculosis. One is pulmonary tuberculosis, in which the disease manifests in the lungs, causing symptoms such as lung abnormalities, hemoptysis, that is blood in the phlegm when coughing, for example, and pain while breathing due to an inflammation in the lungs called pleurism. The other category of tuberculosis is extrapulmonary, which is when the disease spreads to other organs in the body. The symptoms of extrapulmonary tuberculosis will vary according to wherever the bacteria ultimately proliferates. So what are the general symptoms of tuberculosis? Well, there are several. They include cough, fever, loss of appetite, unexplained weight loss, fatigue, and night sweats. These are in addition to the exceptional pulmonary symptoms which we mentioned in the previous slide, or any other issues that may arise from the extrapulmonary variety. Now that we've discussed the potential symptoms of the disease, how is it actually diagnosed? There are several diagnostic tests available. Firstly, the symptoms of the person and their history of exposure to tuberculosis. Chest x-rays can also be especially useful in detecting pulmonary abnormalities, which might be attributable to tuberculosis. If there is suspicion of tuberculosis, a smear test can be done, in which the sputum of the patient is tested by staining it for acid-fast bacilli. Other tests, such as nucleic acid amplification, can also be done. However, the more advanced tests, such as the nucleic acid amplification, are cost-limited and will therefore be very inaccessible in low-income populations. How is tuberculosis treated? The principal treatment is an extended course of antibiotics. While latent tuberculosis can be treated with a single antibiotic, active tuberculosis requires multiple antibiotics, usually 4 or more. The typical 6-month treatment period has an 85% success rate, but compliance is crucial because if a patient stops taking antibiotics early, it can lead to antibiotic resistance, and the tuberculosis can become increasingly difficult to treat. Who has a higher risk? Tuberculosis is much more common among young adults, especially males. It is also much more common in developing countries and in people who are frequently exposed to those with active tuberculosis, such as healthcare workers, nurses, etc. Notably, people with weakened immune systems due to HIV or drug or alcohol abuse will be at much higher risk. And finally, people born in or traveling in places where untreated tuberculosis is common, such as Latin America, Africa, Asia, Eastern Europe, and Russia, are at higher risk of contracting tuberculosis. Can we prevent tuberculosis? Yes, we can. There is a vaccine for tuberculosis, an old vaccine called BCG, but it provides limited effectiveness and is therefore not generally used. Thankfully, other methods of prevention are available, such as hygiene to prevent the spread of cases in the first place, public education in recognizing TB, which can help to reduce the spread and facilitate early treatment, and the availability of testing and treatment, therefore, is key. And finally, proper immune system maintenance can help prevent the disease, which includes proper diet, avoiding the abuse of drugs and alcohol, and promoting early diagnosis and treatment of HIV. In conclusion, tuberculosis is still a serious global problem as it contributes to a significant amount of annual deaths worldwide. We also mentioned that it is preventable, and that prevention relies on public education, effective testing, and treatment. It also is important that people diagnosed with tuberculosis comply with the full treatment, even though it may be very long, in order to avoid antibiotic resistance, which is a much greater problem. It's also important to note that there are still challenges such as resistance to many antibiotics, the lack of proper resources in developing countries, and the lack of better treatments in general, such as more effective medicines and vaccines. Hopefully, public awareness and understanding of tuberculosis can help lead to better testing and treatment options in the near future, and eventually the eradication of this disease altogether.